I'm hoping that most people have made it in from the waiting room now. And I'm aware that this is people's lunchtime, and I don't like to take time away from people, especially when you've given it up so kindly to come and join our webinar series. So I'm Ruth McLaughlin, and I'm really delighted to be launching the Living Lab webinar series. So this is the first webinar in what is going to become a monthly event. And what we want to do is make sure that there's plenty of opportunities to understand about the different projects, approaches, problems that we're working to solve across the Living Laboratory, how different partners and stakeholders are engaging with it and working with us, but also, you know, what are some of the things that we want to explore around entrepreneurialism and such like as well, that we would really appreciate hearing from others about as we think about what we're trying to do in Glasgow to build out sort of a biotech and life sciences. So I'm delighted to be joined today by Professor Ross Cagan. He is the Regius Professor of Precision Medicine. As you can tell by the accent, he's a local. And what we are going to do today is just take you through an introduction to what the Living Laboratory is, what we're trying to achieve, how we can support innovators, regardless of whether you sit in a university or a company. And then we'll have time at the end as well for any questions, and we'll do our best to keep to time so that we do have plenty of time for that discussion. So Ross is going to hopefully share his screen, and then we shall kick off formally.
Yes, and if and when y'all can see, so y'all is a Glaswegian.
It is, yes.
Yeah. I'm not even from Texas. I don't know why I'm saying that. New Jersey. I hope people can see this screen. Somebody can let us know. That would be amazing. Yes, I see. Yes. Thumbs up. So that will work. Brilliant. Yep. Thank you. Also, cool thumbs up.
Yes. So the Living Laboratory is a programme that is supporting healthcare innovation in Glasgow. And it's very much about innovation as a route to impact. And those impacts are across healthcare, economic impacts, and in the broader societal impacts too. It is a bit different from other academic research grants in that it is about very specific area of research and really pushing translational opportunities towards a potential product or a potential spin out, but also really looking at how we support the needs of companies and helping companies build that evidence to support further investment and to position their product and to be able to come into healthcare systems.
Yeah, so we're going to be yakking back and forth, yeah. Okay, and we've sort of shared slides. If you see it looks simple and dumb, that's probably my slide, like this. So, and I just wanted to share a little bit of thoughts and experience. So I'm in addition to running a cancer lab, I'm a serial bio-entrepreneur, so started some companies, and have thought a lot about where Glasgow stands in the ecosystem. And some of you have been, I was away, but my wife and dog managed to make the opening to this new Govan-Partick Bridge. Mm-hmm. And actually, and first of all, understand it was pretty crowded, which is great, and sort of makes my point. So Glasgow, I think we have, many of us have a sort of concerned with view of Glasgow, but I actually want to take a little step back, both at the strengths and challenges and the weaknesses and strengths of where we're at right now with Glasgow. And I think this represents a lot of what's happening now. So I don't think we should mistake the Glasgow today from the Glasgow even 10 years ago, but we still have a ways to go. This bridge here, and we're going to show maps, really represents a larger vision of how we, and this is very much the royal we, there's really quite a few people, and the Living Lab has taken a point position on this, are really trying to build innovation coming down out of the university through across the Clyde River into innovation zones that we'll show you, and then eventually to the hospital QE. And I come from the States, again, surprisingly, given the heavy Glaswegian accent. And I can tell you for sure, I've run clinical trials back in the States and so on. for clinicians and basic researchers to work together in the States is really the exception rather than the rule. They really do live in two different worlds. You hear a lot about how they do better here, but I can actually validate that. It's amazing how easy it is here for clinicians and researchers to actually work hand in hand, and how often that actually happens. I'm always very impressed. It's one of the reasons I actually came here. But I also want to point out that we do have challenges here. So, and many of you are aware of this, and I put this picture up. This actually says lamps from the 60s ferry. So before this bridge went up, the way you went across up through the 1960s, the way you went across the Clyde River was they had a ferry. Actually, they had several ferries that went across. And these red posts on the left and right, which are now becoming lamps, were actually part of those original ferries. That's, I think, the slot that they would come into. And that's because Glasgow, the people who built Glasgow and drove Glasgow really had a vision about what they expected, and they expected the north and south parts of the bank to interact with each other. That got lost somewhere long before I came here. And now that vision is beginning to come back. We're beginning to see Glasgow as a larger, more integrated city. And I think we shouldn't let this moment pass, and the impact of efforts like the Living Laboratory, where we're going to see the investment in a second, which it's right here, where close to $90 million really is getting moved that are related to the Living Lab. For somebody coming in here, I think this is amazing. And when I read literature about Glasgow, they always describe it as a city that is rebounding, is now on the up and up. And some of its neighborhoods are now being described as, quote, coolest neighborhoods in the world, actually, in some cases. And so it is really a city that is on its swing up, but that doesn't just happen, that comes with people. So I don't know if you want to discuss some of the efforts that have been done Scotland-wide on this.
Yeah, I mean, so the living laboratory proposition and how we use it to support that regeneration of Glasgow and the River Clyde has actually been a journey that started, I think it was actually about 2017 or 2018, when the opportunity to put something together to bid for this funding came about. And, you know, at the time we had Professor Damana Dominicek as our head of college, and then also Dr. Carol Clugston as well, who were really driving the way and had really laid the path with those kind of long-standing partnerships that were established between the university and NHS Greater Glasgow and Clyde as well. And this, you know, shared vision around innovation and healthcare, and you know, what were the different opportunities that the partners could embark on that were really going to support innovation. And it's all of that work that has laid the foundation for what we now have in Glasgow and around, you know, the QEOH campus. Apologies, our camera has just fallen off the wall, so we're doing a quick repair job just now. Living lab problem solving at all times. And so yes, it's that long history of partnership and investment, but with that very collective and shared vision around improving healthcare through innovation. That is what the programme is now building on, and we're really focused on what we need to do to continue to strengthen and solidify Glasgow's position on the global stage, but also, you know, this is an area where new technologies come on board all of the time. The needs of innovators change all of the time, and therefore, you know, what we did 2 years ago is not what is needed now. So it's also about continuing to forge new pathways and look at different ways that the assets that we have can work together to support the evolving needs.
Definitely. And as I go to the next slide, I just want to add two things. One, yeah, I got the triple helix discussion from Anna. That was really a vision. That was amazing. And she and Carol did amazing, but there were other people such as yourself who really did play central roles in getting this up and moving. So we just don't have time to give proper credit to all the people who really did this. And this is now a great opportunity to show what that vision is.
Yeah.
So especially for those of you who are here from the commercial side, those of us who work here, of course, this is a really nice way to see what it's going to look like in 5 or 10 years. But those of you here on the commercial side, please know that all of this is aimed at bringing these different communities together. I don't know if you want to say something about the bridge and the HIH, especially the HIH.
Yes, so for those of you who follow us or know a bit about the Living Laboratory, I'm sure you've seen a picture of me with a hard hat on. Over the past week, as I had the privilege of doing the last concrete pour at the top of our new Health Innovation Hub. I have to say, I was not aware that I would be pouring concrete.
How'd you do?
Not very well. I'm going to stick to my day job. I tried to fix it, and then that was the mistake. I shouldn't have tried to fix it. I should have left it as it was in the first place. So the Health Innovation Hub is the new space that is being built specifically for companies to come and co-locate around, this whole ecosystem and being really close proximity to clinicians, to patients, to the different assets that we have. It will also house the Digital Health Validation Lab on the ground floor, and the whole ground floor is also space for the community as well. And so we're working extensively just now on what that actually means and how we make sure that that space feels like it is for everyone who lives around this area. And you can see, that path that Ross was laying out from the QEUH along the waterfront across the new Govan Partick Bridge at Waterrow, and then up and into the university, and also the active travel routes that it opens up as well, in terms of people being able to move easily between both campuses. And I have a slight secret hope or ambition that we end up with electric bikes or scooters or something like that, that help people move around between the places as well.
That would be great. I'm a big fan of e-bikes, much to the annoyance of my biking friends. This.
Yeah, so it's very much a partnership, and the people that you see on the screen here are our founding partners. They are not the only companies that we work with or will work with or are working with, but they are the people who helped create this initial vision, and had also been some of those companies who had been involved in previous projects that had laid some of the groundwork for this, and some of those assets that we continue to benefit from. And you can see that it's not just industry who are our partners. We have been thinking about this sort of a community engagement STEM skills activities as well, with the sort of city region and Glasgow Science Centre, and they're not on this slide, but Scottish Enterprise and the City Council and Invest Glasgow and such like too, are all people that we work with very closely to realise this vision about positioning Glasgow as the place for biotech.
Absolutely. I think this is a good example of all hands on deck. And we need to update, I need to update this slide actually, because we have a lot of partners now.
So I don't want to linger on this for too long, but we all know that there's many determinants of health. And those of us in Glasgow and the west of Scotland also know that in Glasgow we have particular challenges as well. Around health, and our life expectancies and such like are very different than other parts of not just the Scotland and the UK, but actually across that bridge, which is not very far, having walked it on the weekend. You get huge differences as well between the health outcomes of the population, and actually social and economic factors are some of those biggest drivers and determinants of health. And what we also know is that the healthcare systems, and this is not just the NHS, healthcare systems globally are coming under increasing pressures, because we've got ageing populations, we've got lots of people with chronic conditions, morbidities, and actually it's becoming a real challenge to look at how do the NHS and other healthcare systems serve the needs.
Yeah, and I think 2 point, we all know, I think most of us know that Glasgow, by some measures, has the least healthy population of any major city in Europe. This is not right. And to put some numbers to it, males in particular have difficulty here. So median lifespan for a male is 70 in Glasgow, and that's pushed up by certain areas. And median health span, which is how healthy you are, is 60 for a male. And it's only a few years more for women. And so it's not just that they're not living longer. It is that they, during the last decade of their lives, they actually have all sorts of issues. And, these are problems that are solvable. The so-called Glasgow effect that we hear a lot about, when people look more closely at it, there's nothing magical about this. There are specific policies in place that exacerbate this, and there are healthcare decisions that have been made. So these can all be improved, and this is absolutely part of the goal here, is to get this done.
So I think we all know the potential of innovation to benefit clinical pathways, but also patient outcomes as well, both indirectly through the benefits to healthcare systems, but also through things like, wearables and people being able to get real-time information in their own home and environment that allows them to actually manage their conditions and make decisions. And what we're here to do is look at how we can support innovation being brought into these clinical pathways. Disclaimer that I always have to put out here is we cannot influence procurement. That is not what we are here to do. But what we can do is work with you to ensure that we are positioning that product for best chance of success, that we're actually helping you understand what are those particular clinical pathways, where in that pathway does it work best for whatever you're developing and such like, and also how do we start with that early engagement with either people with lived experiences or the different healthcare professionals that you have to engage with. And I should say that when we talk about innovation, it's very broad. It's not one particular type of thing, and so across the bottom, we've just put some of those broad categories that we can very much work to support, AI and telemedicine, digital platforms, pathways, diagnostics, omics, medical devices. It's really anything.
Yeah, and I think just to build on that point, and we're going to show more slides on this, I know, and that is, we spent a lot of time, including a meeting we just had, we spent a lot of time trying to imagine, if you're a researcher or if you're a company and you come in, how close to plug and play can we make it so we solve a lot of the difficult problems and challenges about storage, about I don't know, there's a long list that we can go through that those of you who are coming in as companies know all about. We've actually are spending quite a bit of time to reduce the friction on those so that you can come in and focus on gaining what you need. We know that you need these things as quickly as possible, these sorts of things. This is a lot of mental energy that we go in. So we're going to talk about some exemplars. This is the word here. Exemplars about, hey, we're going to take a project and push it through, but a lot of the reasoning for that is to identify where the challenges are here and actually get those solved. And so, all that. And I think we're going to get deeper into that.
It's about trying to develop repeatable pathways and processes that, can be used for any type of product that requires that type of information, regardless of what the sort of a disease area or patient cohort may be. So whilst we know that there's a huge opportunity of innovation to transform clinical pathways and clinical care, we do know that it's not easy to get things implemented into practice. So what we have put together here on a slide are just, what are some of those barriers to adoption? Now, I'm aware that there are many other challenges around sort of a medical device, medtech development, including funding and all sorts of things, but these are the ones that we can actually
impact.
Yes. And quite often products don't make it because people haven't engaged with the right people in the healthcare systems early enough, and perhaps actually you've gone down a pathway that doesn't make sense, and that's not what's actually happening in health practices just now.
So do you think that's a matter of education?
I think that's part of it, yes. It's actually helping people understand what is the different evidence you need at different points in that journey. And actually, I think sometimes people hear a lot about, the RCT as the gold standard. But actually, that comes quite far along the journey, and it's about almost the minimum viable evidence that you need at each path to secure that further investment or grant funding as you work towards, those bigger trials.
I guess two things I would add to that on that knowledge side is, and this is not a Glasgow specific issue. This is everywhere, but some places more than others. Two things are, one, as Yumi Kasai would tell me all the time, is that there's a big difference between basic research and translational research that we as basic researchers don't always understand. And so that's one thing that we try to create a structure to teach people, or maybe another way is to guide them quickly into something that you can actually get accredited. So that's one thing, and that's a surprisingly difficult learning track. And then I guess the other part would be is being able to talk properly or correctly to clinicians and also to corporations. So what they want can be quite different than what you think is important.
Yeah.
And that connection is maybe the most difficult connection. I know for me, it was just ridiculous. I'm like, this is a great idea. You're going to make buckets of money. That's not how things work. So I think also trying to create systems, and I know you in particular work really hard at this, to create systems where we can help people very quickly aim what they're doing in a sensible place that would get people interested. Do you agree?
I agree. I'm hearing our cameras falling again. So perhaps I can talk about that while you try and
put it back up.
Adjust the camera. Yes, it's about bringing people together as early on in that process as we can, so that you are moving forward with that confidence based on what those people in the healthcare system actually do on a day-to-day. What is the information that they use to make decisions, and therefore what is the key data that you need to be providing them with your products. And I think it's also important to, you get simulation environments which are great and absolutely serve a purpose, but what happens, in hospital settings and GP settings can be quite different, and it can also, be quite different at different times of the day, and when there's different pressures happening as well. And one of the phrases that David Lowe uses that I quite like is that it's, you want to see how far you can push a technology as such, to see what does it take for it to be broken when it's actually being used in that real world environment, because that's what we want to do. We want to work with you to understand what are those things that might break it or mean that it sits on a shelf and it doesn't quite get used. And so the sooner that we can start to bring people together to have those conversations, to think about what that environment is actually going to look like and to start testing it with different users, the more confidence that we can help you build in your product.
I have to say, I've never had to spend more time taping up. I don't know what is going on. So hopefully it's not a problem.
Yeah. So the ecosystem that is established here in Glasgow and the Living Laboratory has been working to strengthen is really about, that opportunity around real world insights, the ability to engage with a wide range of stakeholders, including people with lived experience, to help co-design and actually understand what does their day-to-day look like, how do they want it to be made easier, and actually are you just going to make it more difficult for people who are already under difficult stress and burdens as well. And then we have those number of environments where we can actually take a technology into the real world and start to actually look at how it functions, but then also build that evidence as well.
Yeah, and this camera's driving me nuts. Just to add a bit to that. So one of the efforts of the Living Lab is to reach out in the community and engage them. And as a basic researcher, I'm like, I'll just do our thing in the lab. And what I learned in talking to patients actually changed the way we did our research. So we developed cancer treatments, and I just thought we would just batter the patient with all sorts of nasty stuff. They would just take that hit because we would totally cure their cancer. So it turns out that rarely do you cure them. And the patients, multiple of them, actually sat me down over one lunch in particular and described what their experience is. And from there, we stopped focusing just on crushing the tumor and started focusing on quality of life, which is actually different assays and different efforts. So having them on board really does make a difference. I have to say, I've really become a believer in this.
Well, it makes a huge difference. And then there is also, the funding part of it as well. So that the funding landscape has shifted significantly. And if you don't have those mechanisms
Sure.
to engage, and if you don't have a plan and a credible way that you show that you're going to gather those insights to inform your research, you really don't get funding
Sure.
these days either. So, but this ecosystem, as I say, it didn't spring up overnight. As I mentioned at the start, this has been a journey of many, many years, and the partnership between the university and the NHS. And so what I've attempted to do on the next slide is just to show what are some of those key innovation assets that exist in the ecosystem. Before people start sending me messages saying such and such wasn't on there, this is not a full and exhaustive list. It would be hard to put all of that on one slide. But these are some of the key assets that are very much around that clinical interface and how you the ones that we use to translate something into those clinical settings. And there are assets that are managed and coordinated by the NHS. There are assets that are managed by the University of Glasgow. We've got a number of joint initiatives, but I think one of the other key points is regardless of where the asset sits or who owns it, for want of a better word, we all work together across all of these assets, and we're very lucky over at the QVUH, the building that I usually live in, the West of Scotland Innovation Hub and the Safe Haven are on that same floor. So it's very easy to go and talk to them, clearing the biorepositories in a building, just across the way. So we're all here with that same vision and talk to each other all the time about how we support you.
Sure. And I know it'll come up the Genomics Innovation Alliance, GIA, and they are literally across the hall from the NHS. And I cannot emphasize how important it is that the NHS is a partner to all of this. Yeah. It really short circuits all sorts of challenges. And I have to say, they've been great, actually. Yeah. They've been a great partner.
Yeah.
So that is absolutely, I actually think that's one of the important things that the Living Lab does, is to create a trusted relationship with the NHS.
Yeah,
for sure.
Absolutely. So I'm going to move through these next slides relatively
I got it.
quickly. But what I've just tried to do here is just show you, the different kind of functions or expertise or capabilities that each of these assets offers. Again, these are by no means exhaustive lists. Very hard to put all of that on a slide. But what it's about finding, based on your product, what do you need at that point in time, and therefore which combination of these assets is it that we need to pull together and coordinate for you. So for example, with our shared initiatives like the Digital Health Validation Lab and the Genomics Innovation Alliance, it's very much working about how do we support innovation thinking very, from the very early stage about something that can come in and be scaled up in that clinical environment. We have a whole load of different capabilities that exist as well. And really it's about, I refer to it as a pick and mix, and I never know whether that's quite the right analogy to use, but as somebody who has
the next one?
Yeah, as somebody who has a sweet tooth, that works for me. And so it's about, what is that combination that you need at a particular point in time, noting that, the combination will change as that innovation progresses and develops. And what we are here to do as part of the Living Laboratory and how we work with the NHS is help kind of coordinate and facilitate those. And then what I've just put together on this next slide is an example of one of the projects that's being delivered in the Digital Health Validation Lab, the Radical project, that is looking at a real-world implementation of an AI to facilitate chest x-rays in lung cancer patients. So it's the combination of the West of Scotland Innovation Hub, the Safe Haven, the Digital Health Validation Lab, and our colleagues in HETA, who are delivering that project to generate that evidence to hopefully support that being approved from a regulatory perspective, but then also being brought into practice.
Yeah, we're gonna walk through some of the Living Lab projects, but this is actually a good point to push the idea that if you have projects, either you're a company and you're thinking about, I wonder how I can get involved with this, or if you're a researcher and you're just wondering, is what I'm doing, is it translatable, and what does that even mean? This, I think, makes a good point. We have an infrastructure. Just come talk to us.
Yeah.
Basically, this is the key thing. We'll tell you if you know what, go do that basic research, you're not ready for prime time. And along those lines, it's not just our opinion on this. We do bring in experts, even experts from around the planet, to get a sense of how marketable is it, how translatable is it, what other activity is going on in that space, and so on. So this is really meant to help people not just, push things forward, but make decisions about how they do things, whether they should push them forward. So I actually think that catching us early is probably the best move, because you can see this in the structure. Okay, so we've yacked about theoretically what you can do, okay, and try to give something of a big picture. But many of you have, I'm sure you've gotten this, not so much what is the living lab. Hopefully people have a sense that there's this thing called the living lab and that we do these sorts of things. But I think there is some curiosity as to what exactly is happening. And so we wanted to put in some slides where we just gave you some very specific examples. So the Living Lab has 7 different programs, if you count HIH.
Yep.
7 different programs, and we are going to 2, 4, 6. We're going to talk about 6 of them, I guess, somehow. We just wanted to give you a little sense. We do have a bit of time here. So we wanted to give you a sense of some of the very specific things that are going on, because I actually think that many of these are very cool, and we want to show them all, basically, and show what the Living Lab. Now, the purpose of these is both themselves to help the community, and they were selected for that reason, help biotech infrastructure here, but also as exemplars to, as we talked about, I can't speak today. I think I'm spending too much time taping that thing up. That we wanted something to basically figure out, okay, what are our strengths and weaknesses here? These projects really clarified that, I would say. And so we end up chatting pretty much every week, like, oh man, we got to solve this storage problem kind of thing. And that has been hugely helpful. So see them in that light for why we selected these. These came from a number of projects that were proposed. But I think I have to say, as somebody who has loved to kick around the Living Lab, that it has done an incredible job, that things are actually now really moving forward. And there's some real successes. And this is a great start for success. So this is a 7 Tesla MRI scanner. I believe it was originally obtained by Anna Domenici. It was, yes. By Dame Anna. And it's extremely powerful. It has a massive magnet, and the resolution you can get on these, you can see on the right, is really wild. So you can even see down to almost individual neurons, in this case in the brain. You can see in detail if somebody's developing Alzheimer's at a fairly early stage that we really weren't able to do before. And this has now been connected by Cagan, you can see him here, and his company MR Coil Tech, to creating what are called coils, which are basically the actual imaging structure that gets attached to the larger scanner. And so you have a head coil, head and neck coil, an arm coil, and so on. And Cagan has basically developed technology to really optimize 7 Tesla and make it more user-friendly, and is beginning to take orders on these coils for different body parts. I love this project, actually, and Cagan has just sort of steadily gone about and just built this thing.
He has. Cagan gets embarrassed when I talk about him, because he is the world's foremost RF coil engineer, and I tell him that my ambition for him is world domination. And he gets embarrassed when I say that, but actually every time I talk to him, he has another grant, so he has another contract, he has another really positive piece towards that, and being that provider of the RF coils that go into the 7T scanners globally.
Groovy. Next one, DHVL. Oh man, where to start with this? So I'm just going to say a few brief words. And a big shout out to David Lowe, who has really done an amazing job on this. So the idea here is pretty much what the name says. So if you have digital health items, and you want to basically get them into the commercial system, and if, for example, you want to get them to the NHS, that, of course, is going to always be very challenging. It's a very Wild West world right there, right now, and permissions and infrastructure, and actually even just getting them to interface properly with the current health system that we have here is very challenging. And I think actually having this is really smart. So the idea here is to guide people who have digital health solutions, guide them in terms of getting them to interface properly. And as I said, equally importantly, connecting them with the NHS and getting the conversation going. Does this make sense? Would the NHS be interested? If they are, what are the milestones they might see? This is really a very practical way to move these digital health infrastructures forward.
Yeah, and once it's got its physical home in the new building as well, we will also have those simulation environments where prototypes, can come in. And as I say, we can, to use David's word, we can see what it takes to break them, and therefore, what needs to be done to enable them to succeed when we move them into the real world environment.
Totally. Another one is pharmacogenomics. This one has been a long time coming. So part of being in a city that has, in some cases, an aging population, highly treated population, many of them take 5 or more drugs. I actually didn't realize how common this is, but it's very common. And so the question is, all right, you're taking all these different drugs. Can we identify negative interactions between them in a sort of quick and financially responsible way, so we can help inform the physician about making better choices about what stays and what goes? That's actually a very, as you can imagine, very complicated task. Sandosh has really taken up this baton and has been very patiently putting together a very complicated clinical trial, or really trial of a panel, with the idea of seeing whether these panels actually make financial sense.
Yeah, so this bit is really about how do we build that last piece of evidence to support the implementation of a panel in this area, and it's really looking at the cost effectiveness and the value that it adds to the patients and the system.
Yep. So stay tuned for that. Okay, radiogenomics, one of my favorite projects. I love this project. And also part of the reason I love it is so Kevin Blythe, Canon, these guys have been amazing, NHS. And actually quite a number of now, this is incomplete list. This is a very complicated project and has really been instrumental in us understanding where our strengths, but more importantly, where our challenges lie. If a company comes in and wants to run a project that's going to look a lot like this, it's going to be very common. We can say now we've solved a lot of these problems and have clear solutions to them. So this, and I have to say, 2 years ago, I was like, it was going to be impossible. Okay, so actually, even the meeting we just had earlier today, I think I was ranting about how we managed to actually solve so many of these problems, and I'm really impressed. And that's my rant for that. So basically what this is, it's precision diagnostics, as you see here. And the core of it is taking lung samples and images of patients with lung cancer, non-small cell lung cancer, taking those images and seeing if we can use those images to make predictions about who should receive radiotherapy, how it should be used, also whether we can connect that, I think, to other things such as genomics, more broadly omics, which is coming. And so we're taking a peer into the future there. Artificial intelligence and pathology, we're taking a peer into there. So these are side projects that are decorated around it. But the core is, can we take images and use those in advanced diagnostics in a way that is useful to the patient and is still financially responsible? We're starting with cancer, you see lung, salivary gland tumor, but we're also moving into other diseases as well.
No, I think this is a great project, because for me it's also about the kind of multimodal data, deeply phenotyped patient samples and such like as well, and we know that is what people really need now. So although it has been painful at times to work through how we make all of that happen, and actually what it will enable is really exciting.
Sure. No, I thought it's only been unicorns and roses, but no, but patient consent, storage of data, these are all things that they're foreign to me in terms of how they're done here. So for me, it's been incredible research. Cygnus, we don't need to beat this to death, because this actually, so Nigel Jameson, those of you who are familiar with the big effort here in spatial transcriptomics that Jerry Graham and McInnes and all have really championed. but the center of this has really been Nigel. He has been incredible. So he's a great example of a physician scientist. He sees patients. He has built this incredible spatial transcriptomics, which is now becoming spatial omics. And we can say that Glasgow is actually one of the world leaders in that. When certain companies have their newest machines, we get them first. And then if they look good here, they are a jumping point into the rest of Europe. And there's been, this is now connected to a lot of projects, but radiogenomics in particular. And we're trying to understand at what point does this become practical?
Yes. Right.
And certainly for drug studies, for companies that want to run that, we are set up for this.
Absolutely.
Right, Nigel? And I think we can end that part here. So this is something I'm just going to put to you because this is something you've been really heavily involved with.
Yeah, so we've touched on this already, but one of the things that we know is really beneficial for companies is to be really closely located to, you know, samples, you know, for things like, you know, degradation times, you know, how quickly you can actually access them, to be, you know, across the road from the clinicians and healthcare professionals. Diaries are often challenging, and you know, when somebody says I've got 15 minutes now, when you're there and you're able to say, right, I'll come and find you, it really just helps move things along. So this building is coming. It will open in September of next year. We have a lot of interest already from different companies that we're talking to about bringing them into that building, but it is a large space. You know, there's 4 floors and 65,000 square feet. So if you are interested in space and coming to Glasgow, then please get in touch with us and we can start those conversations now. And also, as we're having those conversations around the space, but start to think about, you know, what are your needs and how do we start to connect you into, you know, the ecosystem and those different assets, and, you know, what is the R&D that we can be supporting in advance of you actually physically moving into the space. So we have about 15 minutes left, and we've got a few more slides to sort of bring things back together and sum up, but we do want to leave time for questions. So if you do have any questions, can I ask that you start putting them into the chat?
Yeah, and I think we can just wrap these up. So this is just a summary of what we've been talking about, which is that we're trying to build a smooth pipeline in. I'm just going to push through that. I just want to say to your point that, so for example, my lab with Joe Edwards and others uses patient tissue in our laboratories. And this route through now with HIH and so on is really going to make that so much easier. For me, I'm going to end my part just by very quickly some of the challenges. I don't want to just say that everything has been, you know, everything is solved, obviously not. Our competition is throughout the world.
Yeah.
So we are now thinking deeply about where the Living Lab is going to land.
Yeah.
So it has another 2 years, and then what is it going to look like? And obviously, we welcome communication about that. I do think we need to really improve our engagement with the community. And when I say community now, I'm talking about with Gavin and so on and so forth. I think we all understand that that is always a challenge, and I think we need to improve that. We are working very hard, including you and me, on the culture of building a culture of bio-entrepreneurship here. This is going to be the long-term win here, I think. We're bringing outside expertise to make sure we're not so insular. A shout out to Gia, Yumi Kasai, and that whole group, Paul Westwood, on building a panel, which in a perfect world will become useful to cancer patients here in Scotland. I think that's something that has a road to go forward, but that's also part of the Living Lab, and I think can really be a huge win for it. And also, we're thinking a lot about the vision of where Glasgow goes and where Scotland goes. And this is really a great opportunity to have this conversation, which is, and the Living Lab is sort of an anchor point to being able to focus and have those conversations in a practical way.
Yeah. So just to summarize, so I hope that what has become clear through this webinar is, you know, that this is an ecosystem where there's a lot of assets that you can access and pull from to really support that innovation development and the growth of your company. And it is very focused on, those particular things. How can we add value that's going to support that product being developed and moving into practice? As I say, it's not a classic university research grant where it's about basic research. It really is, what is the key evidence or the key people that you need to talk to? How do we make that happen, and how does that get you to the next part of the journey? And I'm just going to come back before we open up for some of the questions to the why. Why are we doing this? What is our vision, and what do we want to support? And it really is Glasgow and Scotland's being positioned as a global leader for healthcare innovation. It's about, that horizon scanning. What are the new innovation pathways and the new assets that are needed given the rate at which all of this continues to evolve and develop? And as people start to think about putting things together in different ways, what does that mean are some of the challenges that we need to solve to allow that to happen at scale? And ultimately it's about how do we position those clear routes to health and economic growth. And that's very much about, as I say, it's thinking about the product. What does the product need, and how is that going to help you secure investment or get your product onto to market and utilised? And ultimately, all of these great innovations coming onto market and being utilised is what is going to lead to that benefit to patients and healthcare systems, and allow us all to lead, healthier and wealthier lives.
Healthier and wealthier, I like that.
Wealthier in the quality of life.
And very quickly, this is the email. And as we open up questions, let me just say very quickly, for those of you who have a bio-entrepreneur bent, I think when I first came here, it was challenging to start a company by a variety. That has actually changed quite a bit. And I think now the emphasis now swung back to those who want to actually start the company. So those of you who are maybe thinking about becoming more bio-entrepreneurial, I would encourage you to look into this now. Really, the culture here has changed in the 4 years that I've been here.
Yeah.
Okay, let's.
So we have a question from Agnieszka. Access to medical data and patient samples is highly sought after. How will we address the ethical challenges that may arise when requesting access to biorepository samples for new research projects? Shall I take that, or would you like to?
Yeah, I'm still trying to get this thing to. Oh, here we go.
Okay, so I mean, I guess the first answer is that it comes back to the partnership that we have with the NHS, and it's having those discussions about what might some of those new ethical implications be of some of the requests that might come in, or what people want to do with the samples. We would work very closely with the research governance teams on both sides, and to agree, well, what does that mean? How do we make that work? Actually, should we be making this work? Sometimes the answer will be no, and perhaps we decline certain projects. But then also through the mechanisms that we have to engage with the public and patients, we can go and do some PPIE and consultation work to actually understand how do the patients and the public who are donating these samples feel about some of these proposed new uses. Are they supportive? Are they not supportive? And we can use that as well to inform, how far the boundaries can be comfortably pushed, or when we actually just say, no, that's not appropriate. So I guess my short answer is it's all done through dialogue with the NHS and the people who are actually the governing, or hold that governance around the samples, but also by continuing to have that dialogue with the people who are donating the samples as well. Yeah,
so I think that's and just exactly the punchline is basically come talk to us. Some of you may know, so what you're talking about is that patients get consented, and that consent has boundaries to it. So the patient can consent to use it for a particular study, or just University of Glasgow, or everybody and so on. And so different consents have been written differently over the years. So some of the older patient tissue is more challenging. That doesn't mean you cannot use it. So you can go back and reconsent it. So there are various things you can do. So yeah, the punchline is, yes, patient tissue can be challenging to get hold of. Some of that is just the sheer volume of requests for it, and some of that is consent. But again, the punchline is this is completely doable. I and many others do this. And I think you can just come to us and we can, as you say, we can basically lay a plan out for whether it's doable. So
not seeing any further questions that have come in, so maybe just in the absence of any questions, any final thoughts, Ross, or anything that you want to make sure, you know, the people on the webinar leave with?
Yeah, so you know, the Living Lab has been going for 4 years now, is that right? And I think it has started, as I mentioned at the beginning, I, like many, were frustrated. But I have been really pleased with the progress that has been made. You know, a number of people, yourself, Neil Bowering, many others have pitched in to really move this battleship. More importantly than what the Living Lab is doing is how the culture of Glasgow is beginning to change. As a researcher who came here from my beloved New York City, and it was a hard transition to make here, but one of the reasons I came here is it was supposed to be easier to get hold of patient tissue and these sorts of things. And I think that is becoming a reality now. For those of you who maybe have gotten a little cynical about things like that, I would recommend that you actually, and you're probably surprised to hear me being so optimistic because I can get frustrated at times. But I would actually really recommend that you take another look at what can be done now. Due to efforts from a number of people, this really has begun to change quite a bit. And that's a lot of words, but what I mean by that is if you want to get patient tissue now, it is, I think, doable. If you want to figure out issues of, well, where am I going to store all this data that I do? Now I think we have a way to get around that. Artificial intelligence, how does that even fit into things? Well, now we actually have a plan for this, right? So all these different things. And what I would like to see is I would like to see the UG researchers take more advantage of this. I would definitely welcome companies. I think the next step is that we do need to get more companies involved, not just so that we can build a biotech economy here, which I think is really important. I think shipbuilding is done. I think biotech makes sense. But also because we learn when we interact with companies like Canon and NanoString and Lumina and a number of other ones that we've interacted with, that I think really helps us move forward. So for those of you who just think, okay, this is so difficult, give it another shot. Now, I think even from just a few years ago, things really are genuinely different now. I am actually really enjoying my lab and McNabb Center and all that stuff, being able to get stuff done. That actually would be the biggest message I would bring forward here is things, you know, everything changes. And the Living Lab has really changed things quite a bit now so that things become more doable. I don't know how you could you watch this longer than I have?
I've watched this for a very long time as well, and I agree. I think it's now reached the tipping point where, you know, it's really moving into delivery phase, not just of the exemplar projects we talked about, but actually how all those pathways, you know, that they have helped lay out can really now be used to support a whole pipeline of new opportunities coming through. And we're starting to see that, you know, through the DHVL and all of the people who want to work with Nigel around spatial and such like. And, you know, we're working through, I know Kevin's got a list of people who want to access that, you know, radiogenomics data set and such like too. So for me, we're at that point where now it can scale. And I think the past few years have been about building the foundations to enable that scale to come. But obviously we know as well that people's needs continue to evolve and continue to change. And whilst it is hard to build those new pathways, there's a great sense of sort of a satisfaction when you have done it and you know that we now have something else that people need too. So I'm really positive. I feel really positive, and I'm not just saying that because of my job title, you know, but about where it's at and where it's moving, and how it's really helping shape Glasgow and positioning within, you know, the sort of the city regions plan and strategic aspirations around life sciences and healthcare and what that will enable us to do and leave as a legacy for Glasgow.
Definitely, and just to add to your point. It is always easy to wait for others to make changes, but we are those others. Right. And so for those of you who are interested in getting more involved, either in the community, maybe more bio-entrepreneurial, maybe some of the basic researchers are worried about people in your lab and what sorts of jobs they're going to get and so on. We are that. This sounds like but it's true. We are the change. There's nobody else that's going to do it. We do this. And that's why I appreciate the fact that so many people have stepped up and have lifted Glasgow up. And like I said, if you want to really get a good view of Glasgow, look out at the literature, which I do all the time because I get New York Times every day, and hear what they are saying now about Glasgow. But that's because there has been a plan, and I think in the future, there'll probably be like quantum computing will be,
Yep.
but pretty much I think some version of biotech is going to be what's going to drive Glasgow forward. And we have a unique opportunity right now. The Living Lab is this sort of big bolus of attention and resources and focus. And the way that we can make sure that that has legs to it is if everybody basically helps and gets involved.
Yeah.
Folks.
Well, I'm aware we've got 2 minutes left,
Yeah.
and so I'm going to just wrap up there and thank everybody for taking the time to join us for this first webinar. As I say, it's going to be a monthly event where you can hear about the different projects, stakeholders and such like in more detail. But it's also not the only types of events and activities that we're now rolling out across the programme. We've got our symposium that will be in November again of this year that you will see coming out this week. There are boot camps being planned to support that, you know, the kind of understanding of what are the needs, how do I go about actually accessing these things and building that evidence. And then there'll be seminars as well. So if you're not already on our mailing list, there's a link on the web pages so that you can be kept abreast of what's happening and what's coming. But also if there are specific topics that you would like us to bring to these webinars, or, you know, potentially for some of the seminars that we might run, then please drop us an email, because this is about, you know, what do our stakeholders need. We have certain thoughts and understanding, and we talk to some stakeholders, but, you know, the pool is so diverse that we want to make sure that what we're actually offering meets the needs of the many. So thank you very much. It's been a pleasure, and I look forward to talking with you all again.
It's been cool. Thanks. Thanks, everybody.
Thank you.